Stop for a moment. Before you flush the toilet again, there's something you need to understand. Your body may already be warning you about a serious problem, long before pain appears, long before blood tests show anything, and long before most people ever think to see a doctor. What many people don't realize is that your digestive system leaves clues behind every single day. And most of the time, those clues are ignored, dismissed, or quite literally flushed away. Doctors often hear the same heartbreaking sentence from patients diagnosed too late. I noticed something was off months ago, but I thought it was nothing. What comes out of your body can reflect what's happening inside, sometimes months or even years before disease becomes advanced. And here's the most dangerous part. The most serious warning signs are not always dramatic or obvious. Sometimes they're subtle, easy to overlook, easy to forget. But if you know what to look for, you gain power. Early detection can mean simpler treatment and survival rates above 90%. Your toilet bowl offers a free daily health check if you know how to read the signs. Many people believe serious illness appears suddenly, but in reality, most conditions develop slowly and quietly. The problem is not that warning signs don't exist, it's that most people are never taught how to recognize them. Digestive health is one of the clearest mirrors of what's happening inside your body. Your intestines are not only responsible for waste removal, but also for nutrient absorption, immune regulation, and inflammation control. When something is off in this system, the effects often appear in stool long before symptoms show up elsewhere. Doctors rely heavily on blood tests and imaging, but visual changes in stool can appear much earlier than abnormalities in lab results. This is why consistency matters more than a single observation. One unusual bowel movement is rarely a cause for alarm. Patterns, repetition, and unexplained changes are what truly matter. To understand stool appearance clearly, physicians use a medical tool called the Bristol Stool Scale. It categorizes stool into 7 types, from very hard pellets to completely liquid. It may feel uncomfortable to talk about, but it is one of the simplest and most effective ways to monitor gut health at home. The ideal stool is formed, smooth, soft, easy to pass, and medium brown in color. Hard, separate pellets indicate constipation. This means stool is staying in the colon too long, drying out, and increasing pressure and inflammation. Over time, chronic constipation can contribute to hemorrhoids, fissures, discomfort, and inflammation throughout the body. On the opposite end, completely liquid stool indicates that the intestine is moving too fast and nutrients are not being absorbed properly. Neither extreme is healthy. Doctors recommend balance: formed but soft, not painful, not urgent, and not difficult to pass. Color tells an important story. Normal stool is brown because bile, which starts out green, changes color during digestion. That familiar brown color usually means digestion is functioning as expected. Green stool is often harmless. It can occur when food moves too quickly through the intestine or after eating large amounts of leafy greens. However, pale, clay-colored, white, or yellowish stool that lasts more than a few days should never be ignored. This may signal poor fat digestion, parasitic infection, or problems involving the liver, pancreas, or bile ducts. Persistent color changes deserve attention. Frequency matters just as much as form and color. Ideally, you should have a complete bowel movement daily, often around the same time each day. Some people naturally go every other day, and that can be normal if it is consistent and you feel fully emptied. But when several days pass without a bowel movement, or when your usual pattern suddenly changes without explanation, that is a red flag. These changes are not random. They may reflect dehydration, low fiber intake, chronic stress, hormonal shifts, medication effects, sleep disruption, or more serious digestive conditions. Stress plays a powerful role in digestion. Chronic stress can slow intestinal movement for some people and speed it up for others. This is why long-term stress may cause constipation, diarrhea, or alternating patterns. Sleep also matters more than most people realize. Poor or irregular sleep disrupts hormones that regulate digestion and bowel function. Many people notice digestive changes after weeks of poor sleep, even if their diet stays the same. Hydration is equally critical. Even mild dehydration can harden stool, slow transit time, and increase strain during bowel movements. Now let's talk about shape. Healthy stool is usually about the width of a banana. If stool becomes consistently thin, narrow, or pencil-like, this may suggest narrowing somewhere in the intestine. This does not automatically mean cancer. Low fiber intake, muscle tension, or structural changes can contribute. However, persistent narrow stools, especially if this is new for you, should be evaluated promptly. Another warning sign is incomplete emptying. You should feel clear relief after a bowel movement. Constantly feeling the urge to go, even after you already have, often indicates inflammation or dysfunction within the intestine. Let's address constipation and diarrhea. For constipation, many experts recommend starting the day with a full glass of water before anything else. Hydration helps activate intestinal movement. Gradually increasing fiber is also important. Chia seeds, ground flaxseed, fruits with skin, kiwi, apples, prunes, and papaya are commonly recommended. Gentle natural juices made with celery, apple, and fresh ginger may support digestion for some people. On the other hand, diarrhea that lasts longer than 4 weeks is considered chronic and always requires proper medical evaluation. Chronic diarrhea can lead to dehydration, nutrient deficiencies, and usually signals an underlying condition that needs treatment. Now we reach the most critical warning signs. Black tar-like stool, often described as sticky or coal-like, is a medical emergency. This usually indicates significant bleeding in the upper digestive tract, such as the stomach or small intestine. Possible causes include bleeding ulcers, damaged blood vessels, or hidden internal bleeding, including cancer. If this ever occurs, do not wait. Seek medical attention immediately. Bright red blood is also serious. Blood on toilet paper, on the stool surface, or mixed into stool may come from hemorrhoids or small tears, but it can also indicate polyps or colorectal cancer. Blood in stool should never be dismissed or self-diagnosed. Proper examination is essential. Now let's focus on prevention. Move your body every day. Physical movement stimulates intestinal contractions. Walking, stretching, and staying active throughout the day significantly improve digestion. Follow colorectal screening recommendations. Many experts advise screening starting around age 45 to 50, earlier if there is a family history. Colorectal cancer often develops silently for years, and early screening can prevent it before it becomes dangerous. Protect your gut microbiome. Your intestines are home to trillions of microorganisms that influence digestion, immunity, inflammation, mood, metabolism, and overall health. A healthy microbiome supports energy, mental clarity, and immune resilience. Unnecessary antibiotic use can severely disrupt this ecosystem. Antibiotics should be used only when truly needed. To support gut health, many doctors recommend fermented foods such as unsweetened yogurt with live cultures, kefir, sauerkraut, kimchi, and traditional fermented vegetables. Prebiotic foods, including oats, bananas, apples, onions, garlic, seeds, whole grains, and vegetables, feed beneficial bacteria and help them thrive. This is preventive health you can influence every single day. Your digestive system is deeply connected to your overall health and long-term well-being. Paying attention to warning signs is not about fear. It is about awareness and empowerment. Small, consistent habits can prevent serious problems before they begin. Start paying attention today. Observe patterns. Notice changes. Respond early. This video is intended for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with questions regarding your health or symptoms. Thank you for watching. If this video was helpful, please subscribe to the channel. Share it with someone you care about and want to protect. Take care of yourself and take care of your health.